continuing our feature with the Guam Behavioral Health and Wellness Center every Tuesday during May. They're coming on to share a little bit more about mental health awareness. And this morning, we're bringing on the people from the Link program. Oh, look at that. We're the Link. You're the Link. Ah, it's so cute. And this, and let's go and we got Jesse Libby, who's hold on, let me get your title right here, Jesse. He's thank you, project director for Project Link. Tyrone Bryan, who is the interim administrator for Child and Adolescent Services Division, and Ovita Perez, psychiatric social worker too. We'll just go ahead and start with you, Jesse. Again, what does Link stand for?
Okay, well, good morning, everybody. Thank you so much for having us. So Project Link, it's LINC, which stands for Linking Individuals and Nurturing Communities. We are a 5-year federally funded grant that was awarded to the Guam Behavioral Health and Wellness Center from SAMHSA, our federal partners, which stands for the Substance Abuse and Mental Health Services Administration, which is a division under the U.S. Department of Health and Human Services. So for Project Link, our mission is to provide behavioral health services to youth ages 5 to 18 with a serious emotional disturbance or a co-occurring disorder. And in addition to that, the youth must be experiencing homelessness. If I may, I just want to break down what that all means, right? Because it really is a big pill to swallow, right? So a serious emotional disturbance is a psychiatric diagnosis that affects one's function, a psychiatric diagnosis that of sufficient duration that affects one's functioning in at least 2 or more settings. And then also co-occurring disorder is an SED, the serious emotional disturbance, along with the substance use disorder. Now to the homelessness part, I just want to say, I just want to emphasize is the experiencing homelessness part is that I really want to emphasize, because our federal grantors have really given us 5 categories that allow us to serve a very broad community in our island, which stands for, and it goes into unsheltered homeless youth, to youth that are living in homes that are not meant for human habitation, individuals that are living in homeless shelters, and then also what also is a very broad definition that allows us to utilize is families that are living with other families. They call it doubled up. So like multi-generational homes, or like mom and dad and family is living with mom's sister or dad's brother or whatnot. And so that's the component of our entry criteria for Project Leap.
Right. So you're basically saying families who are doubling up, is the second family considered homeless?
Yes. Okay. So that's the risk of homelessness, right? So if at any point, let's say the head of household, dad's brother, just says, you know what, you guys got to go. Yeah. That's the risk part of our definition, and so we can serve that population.
Jesse, can you give us maybe anecdotally, generally speaking, some examples of a serious emotional disturbance?
Yeah, sure. So let's say a youth is experiencing depression, right? And depression for a sufficient duration, about like 2 months. And families have noticed that it's affecting their functioning in the home or in the school setting. That's where we would definitely ask them to come in, and we would do a full clinical intake service, and we would begin the process of formally treating that youth.
Let's go over to Tyrone here for a child, because I was thinking when you first told me what this grant is about, like people out there might think right off the bat, like, oh, homeless youth, we don't really have that. I mean, but we do, like, right. homeless, because right. Just the definition of homeless, like the actual definition of it, doesn't necessarily mean that you're out there sleeping at Paseo. That is, yeah, that's homeless.
Right.
But there are many
Right.
who live in substandard homes, or like Jesse had talked
Hmm.
about, multi-family homes. Like, my family,
Hmm.
we spent a lot of time growing up at Grandpa and Grandma's house, or
Right.
going to live with Uncle Phil for the
Hmm.
week or whatever. So yeah, it might seem on its surface like you think, oh, this must be something for a grant for the states because there are a lot of homeless kids over there. But no, the reality is we have homeless kids right here on this
Right.
island, right? And Ty, let's jump over to you here, because it's very unnerving to know that kids need these kind of services, right? So let's talk about, as the interim administrator for child adolescent services over at Jibwick. I mean, what types of kids are we seeing coming in, and what's the need for the services that the department offers?
Good morning, and thank you for having us. As you stated, the Child Adolescent Services Division, I would like to offer the shortened version of that word, which is CASDs for our purposes. So if you ever mention CASD, that's what it stands for. And also, our division is also known as Ifamaguntan, just in case
Okay,
people might know about that in the community.
right.
And for short, you can call it EFAM. So CASD or EFAM. All right. So the young people who come to us for our services, they also have some of the situations that Bissy aptly described. But when he described how they have serious emotional disturbances, we look at what is the what is the young person's presentation in school, at home, and with his or her peers. And when we see that there is a dysfunction in those areas, that's when we try to provide the best comprehensive services that's available. And typically, we adhere to the wraparound services. So when we work with our young people, we tap one of our social workers to create a relationship, and we utilize the wraparound approach to ensure that the services that we're going to deliver are not duplicated. So if we need to make a referral to, like, say, Jesse's program, we'll do so once we ascertain that young person needs help with home and also residence. But if there are other issues, say the young person is involved with the court system, then we would then also reach out to the court system and provide a wraparound approach. And if it's with GDOE, we do the same. And even if it's with the DEA, we do the same as well.
How many kids are we talking about here that kind of go through the Ifamaguanta program?
So without giving an exact number, I would say we're nearing 300. That's an active caseload.
Wow.
And keep in mind, sorry,
Go no, go ahead.
most people are not, sorry, most people are not accessing our services. So those who are coming in, that's what we have right now. Approximately 300 young people who are actively on our caseload.
But again, without getting into the specifics, and maybe Ovi, you might want to jump in here, just so people have an idea. Because if you said people aren't utilizing the program, maybe they're just not clear on what they get from it or who this program will benefit. So just give us some examples of some of the cases. Again, without I don't want you to use names or anything, but some of the cases that you see coming through Ifamaguanta or even Link. Hi, Ovi.
Hi. Most of the kids, at least a lot of them that I serve, are referred by CPS. I've been seeing a lot of children that are undergoing PTSD diagnosis, which means that they have been exposed to severe either family violence, abuse, and neglect. So that has really been on the rise lately. I also see a lot of suicidal ideations where they, and some of it is impacted by COVID, some not. Um, their thoughts of hurting themselves. Some have overdosed on pills. I've seen a lot of depression and anxiety as well, and that's because of the relationship issues, parent-child relationship issues. There's a lot of that coming through. We have a lot of mood disorders. They just have a feelings of a lot of sadness and overwhelming anxiousness, anxiety, worries, fears, and things of that nature. So a lot of that has been coming through our Ifamagonta. So I've also recently been assigned to the children inpatient unit, and that is really where is excessive, constant, intense work that the children are dealing with. So Guam Behavioral has really been busy this last year. A lot of it has been COVID related, a lot, really with the closing of the schools and things like that. So hopefully, if I'm going to started out as a project in the early 2000. Right. So hopefully I am really envisioning Jesse's program, Project Link, to become sustainable after the 5-year term has come up, because that's what if I'm going to start it off with in terms of the mental health for children. So we mirror a lot of our services with Project Link, except for the fact that they're honing in on the homelessness side of children and families.
Man, Ovi, it's so sad, the issues that you talk about facing our young ones, especially when they're issues that are brought on by the parents. When you talk about the sadness, the depression because of the pandemic, what are you hearing from some of these youngsters? Right, because we know we know the grown-ups, the adults have had, obviously there's so many issues that came with the lockdown and the uncertainty and even the fear of, transmitting, dying from this virus, right? So do kids, are they able to, and especially the young ones, are they able to like grasp all of that in their little minds, or do they just kind of feed off what the grown-ups in the home are feeling, or both?
A lot of times they're because they're home with their parents, and if they're coming from homes that are a lot of drugs, so they see that they're home a lot, so they see that, so of course they're going to react to that. And then with the sad cases that's coming through are the CPS related, where CPS comes in and take away the children, and then the kids are placed in all these different shelters, right? So the separation from their families is, no matter how dysfunctional your parents are, right? The kids still love them. They still yearn to be with their families. So separating them without really finding a way to have them interact is a big part of our challenge. Is I know you want to see your parents. I know you, but we have to go through the protocol. CPS, they don't understand that. All they know is that they were, they came in and they were taken away from their homes without even knowing why. So we try to kind of break that down and try to help them understand in order to cope that whatever happened is not their fault. So a lot of times they blame themselves, the kids blame themselves, that, maybe it's because of my behavior that, my mom and dad got into a fight or things like that. No, it's not your fault. You also, I see a lot of the kids being the parents, taking on the role, parenthesizing their parents. So they feel that they need, especially the older ones, they feel like they have to be the one to take over the role of their parents, which is not. And I said, no, you need to be a youth, you need to be an adolescent. That role is separate. So we try to unpeel that kind of emotional state. It's difficult, but it just takes a lot of patience and time.
I'm sure. It's just the problems, like in my generation, like I was the adult because my mom had to work so many jobs to support us, right? But to hear now that kids have to be the adult because their parents are strung out on drugs, it breaks my heart, man. And Jesse, I'm pretty sure that with the homeless and at risk of being homeless youth that you guys serve, is drugs, is it a big part of the equation in a lot of the cases?
Yeah, we do have youth who were exposed to, for their parents or are on drugs, and we even also have youth who experimented with drugs themselves, and so it really is helping them navigate not only through their emotions but through life itself, right? Because for youth and adolescents, this is a developmental stage for them, and so for them as they grow up, they're being introduced to new emotions, new feelings, and they really need that They really need that guidance, that openness with their family, with their loved one, to help process what they're going through, what they're feeling. And so it's very important that, especially with this developmental phase, that we all lend a caring hand and an open, like an open heart and ear, listen to them, acknowledge what they're going through, acknowledge what they're feeling, because it's their own feelings, and it's everybody's entitled um, to their emotions and to their experiences. And it's very important that we don't neglect it by tossing it aside and saying, you know what, you're just being dramatic, or you're just being silly. Listen and talk to them and have that open and frank discussion with them, and help them.
I grew up in a house where some of my elder relatives were on drugs, crystal meth particularly, and it becomes like this thing. This is when I was very young. It becomes this like secret that everybody in the house has to carry with them because it's family, and you wouldn't let go call the cops on your uncle or whatever. Do you guys hear a lot about that kind of thing where it's like there's this stigma, and we're talking about stigma for mental health awareness, right? There's got to be a stigma with being involved with family using drugs. Then there's also got to be a stigma with these kids because they're kids. And I mean, Ovi, when you tell us that, oh, the kids are depressed or oh, they're sad, I know there's a lot of adults out there like, oh, come on, these kids nowadays, like, what do you even got to be sad about? You know what I mean? You guys have everything. So I think a lot of
So
adults like just it's generational. Maybe we just don't get it. But is that something that you guys hear about where kids are having to just like carry secrets that they shouldn't have to carry?
so may I add that the reason why I mentioned earlier that one of the reasons why our kids are probably not accessing or benefiting from our services as much as they should is because of the mere fact that you mentioned stigma. So with the stigma effect, some families may not want the child to receive services because what if they tattle, right? So I've done countless numbers of intakes where the family was hovering over the young person, ensuring that whatever was being said wouldn't compromise the family secret. And the reason why most of our kids have distress is because they are carrying a family secret. Somebody who they know touched them inappropriately,
Mm.
somebody they know, like you mentioned, you reference your family situation. A lot of that happens. So it's not even anecdotal. If we were to compile the reports, we would see that quite a few of our young people are carrying adult secrets. And the stigma effect is this: the young people, they only can follow the lead of the adults. And might I just kind of shift off and mention this? The young people in Guam, and I'm making a very blanket statement. The young people in Guam are very resilient, they're very talented, and they're some of the most awesome young people I've ever worked with. Honestly speaking, the reason why they're in the position they are in is because oftentimes it's the adults who are not there to provide that rock, that guidance. So the transference that we see in the young people's lives comes from the dysfunction in the lives of the adults. And I might as well just say that bluntly.
Yeah. Ovi, this has got to be one of the toughest jobs out there. And I'm not trying to make it about you, right? But I mean, just hearing what you're telling me now here, and I know you can't even get into the details. It friggin' breaks my heart, right? To know that
It is a very, Chris, it is a very, very hard job, but it's very, very needed. So in terms of the stigma, we're already starting the movement to kind of integrate mental health with the regular health. AMC has started their own clinics. So we really need to work harder in terms of changing policies to make that become reality across the board, where you can just come in, you don't have to wait to go to mental health because of the stigma that's attached to it. And just go into a regular clinic and see a doctor and then be referred to their own behavioral health personnel there. So hopefully, I really hope that, at some point in the near future, mental health is regarded that way, that it starts with our minds. right? I mean, we may look okay, we may go about our business, be okay, but really when we go home, we're so closed out. I mean, I'm in the profession, but when this COVID hit, I find myself being depressed. So I need to go back and reflect on what I've learned, to help myself. Because really it's hard, it's difficult. But I love my job. I really love, and I really love the fact that I work with children. I think I've found a niche in working, starting from my work at DYA, and then now to behavioral health. The children, they're going to grow up to become adults. So if I really believe, my personal philosophy is that if we are able to save one child from experiencing mental illness as an adult, then we've done our job. But still, the programs I opened up the newspaper and I've seen some of the kids that I work with, and I somehow the system failed. Somehow.
You can't
right?
reach
So
you can't reach every one of them, right?
yeah. So, but don't let that stop you from trying.
Right.
And that's why we really need to. I hone in with my work with the youth and adolescents is that okay, you're in this state right now, but it's not permanent, right? And it's up to you to change your life now. Where do you see yourself going, right? You have all the potential. What do you really want? And you focus it on them and not on their parents, because we can. There's a lot of us that are really out there that came from dysfunctional home, but yet are able to rise above the challenges. So we just need to really have them believe that. And I also believe that if there's one adult that's there that can really help that one child. I mean, I see that there's a lot of foster, that we're lacking foster children.
Yeah.
That really bothers me, because as a Chamorro woman, where are all the godparents?
Yeah.
When I baptize a child, there's like 10 of us, manunggi siya na tawag, right? Where are those parents that vowed to be a godchild, that when the parents failed, they're supposed to step in? So I don't know. It's hopefully we can find a better way
Right.
to.
Yeah. Ovi, I mean, to be fair though, I mean, I still see the Poksai, like with extended family raising up. And I mean, we all went around to Uncle Auntie's house. I mean, not even people kids without trauma, right? I mean, it was just kind of like, hey, Uncle Raymond wants to borrow you for the weekend to work at the ranch or whatever, you know what I mean? But I do still see it, but it's not like in the system, right? So I know we need the foster parents, but I do want to shout out and recognize so many of our extended family members who see the situation where, the dad is on drugs, he's in and out of jail, or maybe the mom is on drugs. And it just breaks my heart, because we're talking about drugs every day on this show. But I feel like we're not talking about the children who are being affected by the parents and the people who are in their lives who are supposed to be responsible for their care, just having their own issues. I mean, and you're right, it's an addiction thing, and I can't even imagine kids having to be grown-ups. I mean, maybe not even taking care of siblings, but just having to deal with these very grown-up things like, mom or dad is in jail because they're stealing to support their habit, or we can't go to this family's house because they already stole from them, so we're not welcome there anymore. And these force our kids to grow up so fast. And I mean, I'm so fortunate because I got 5 amazing kids who grew up at their own pace. And, I mean, we had issues, but I mean, to see so many of these kids out here who are like 10, 11, 9 years old, 8 years old, just little adults who are talking about adult things, who know about adult things. I mean, it's the people like you who are like really on the front line. Like you said, I mean, what Jesse had said about developing stages, right? That's why it's so key to reach these kids now, because I mean, a tree is going to reach for the sun, right? But a tree is going to grow any way it has to grow. If it has to grow crooked to try and find that sun, I mean, these kids. They're going to grow any which way they can. And it's important for you guys to get that intervention at this stage, right? So that you can kind of like correct them to grow maybe a little straighter or grow a little stronger.
So hopefully one day you'll change, but it's so bad. The drugs on Guam, and really, I just really want to say that the parents really need to prioritize to their children that they're going to grow up, and this is the life that they're seeing, and it's really sad. It's it's really bad on Guam. So hopefully, with our agency, we're leading more towards drug and alcohol abuse, and opening up the facilities to
Right.
help
Yeah.
that are in need.
Right. Yeah. So I mean, Ovi, I mean, it's so easy to feel defeated, right, guys? Seeing what you see every day, and I can tell you're getting emotional. But what about those bright spots, those kids that do get reached, that you are able to turn around? What's that feeling like?
I've seen a lot that have that came in for really major depressive symptoms, and they're out in the military now. They're and I see some that have left Guam to go to other family members in the states that are doing well. So we really do have success stories. A lot of kids that are able to graduate and get into UOG or DCC. So there are, it's hard, but there are some that really just realize that this is my life and I'm going to take control of it, because nobody can dictate how my life goes except me. I'm going to make that choice, and I'm going to work it and go from there. So there are, despite the disheartening challenges of what we're going through, there are success stories. And like Tyrone said, these kids, they are so resilient. They are able. They just really need to turn on that light bulb in their minds and realize that it can work and they can get better, and there is hope.
Amen. We just have
Yeah,
some of the most amazing children on this island. You're right about that, Ovita. Guys, we got to wrap.
yeah.
Go ahead, Ty. Go ahead, add something, and then we'll just go around. Jess, if you could, before we close, how do they get a hold of you guys for services? Same thing with you, Ty. Go ahead.
No, I just want to give a shout out to all the entities in the community who are working with us and who are seeing their own successes as well. For example, one of the ways that we can help reach our young people too is providing sports outlet. So for the mayors who are refurbishing the youth centers or the basketball courts, or mowing the soccer fields, for GFA for providing youth programs in the past and is looking to do so again, for all the other community-based providers who are also working with us and who are also providing beds for the homeless kids, and for those who are actually working in the community like West Care or Sanctuary, the shelter, all of them, they're providing these services and they're seeing their successes too. So we are not defeated. We are actually working and providing a lot of hope. And I know one young person I was recently working with who sent me a text and said, "Sorry, Mr. Ty, I no longer need you." So I'm just giving a shout
I'm
out to that
giving her
person.
something to do though, but
Yeah.
go ahead.
That's good.
Yeah, so
Good
I
news.
just wanted to mention that like we are not defeated.
Of
We're
course not.
actually
Yeah.
doing a lot of work in the community and we see a lot of turnaround for the best. And I want to encourage Guam to invest in the young people, because one day we're all going to grow old and we're not going to be able to take over things. And if we invest in our youths, we will see the positive turnaround.
Well said, Ty. Jesse, let's close it out here, my friend.
All right. No, thank you. I absolutely agree with both of them. Thank you so much for our partners for really referring the youth to us, that that we can absolutely do our thing and dig a little deeper and see, is there some emotional things that we can address? What can we help with early on? That way, when they do become older, that that they're more resilient. That when they encounter things and struggles, that they have the skills needed to address it, that we were able to help with, right? And so we're really grateful for our partners, and also help break the stigma. Stigma is really the major barrier for people to come forward and seek help. I see it when we go out into the schools, we talk to kids. There's various words that they use out there, that really impede people from reaching out for help. And so I challenge everybody, to have a easy conversation with people. Ask them, how are you doing? How's your day going? Acknowledge what they're going through. And if if they need help, call us. Call our crisis hotline, 647-8833. You know, you can also call the National Suicide Prevention Line at 1-800-2822-88. It's a Logic song.
Yeah, yeah,
I
yeah,
should
yeah.
know that by
Just
heart.
go listen to Logic.
Right, you can play it afterwards.
Yeah,
but,
yeah, yeah.
you know, there's a lot of help out there. There's a lot of help out there, and we're here to help, and we want to help, and
Right.
so really thank you so much for having us.
Of course, man.
Um,
Ovi, I feel you, ma'am. I feel you. I know. God, I can just read it on your face how seriously you take this, and I'm right there with you. I just got to say, I mean, let's not take the pressure off the community because it does take a village, and I just feel like we just got to do better for our kids, for everybody. You know what I mean? We need to get back to that, like you said. You know, where are these people at? The ones who step up and fill in the gaps, right? Go be a foster parent.
Yes. Yeah. Just don't quit. Let's not quit. You know, let's not give up on the children. Let's not
Yes.
give up hope
Yeah.
for our people. You know, it's tough, but I think we just need to let them know that what they're doing as adults is trickling down. But there is hope, and reach out to us. You know, there's hope. There's counselors in our programs. There's social workers that we just have. Just come in and get help, and don't worry about the stigma, because there's not, each and every one of us has gone through some kind of mental health challenge at some point in our life, so there is help out there, and you're not alone. We're here to help.
Thank you, guys.
Thank you for having us.
Of course.
Thank you.
Be safe. And thank you.
Okay.
Okay, Hogama. Yeah, guys, that stigma, that's one of the silver linings. I mean, unfortunately, because COVID brought on a lot of these mental health issues that we're discussing. But that's one of the silver linings, I think, of COVID is that we're able to talk more openly about mental health issues like depression, sadness, dealing with this pandemic, right? It's kind of become a normal conversation. But yeah, break that stigma, guys. Go to therapy. I've been to therapy. It's actually fun. I mean, think about it, right? When you're going through stuff on Guam, it's like you don't want to tell your friends, you don't want to tell your family because, it's Chamorro News Network. Let's just be honest. Nobody can keep a secret on this island. But life hack therapists have to keep the secret. That's like the number one thing they can't tell anyone. Unless, of course, you're committing crime, then they have an obligation. But I know you guys are good. So, yeah, I mean, go and get yourself checked. Have a talk, right? Do a self-assessment. Don't be scared to look at what's going on, because guess what? A lot of people are going through very similar things, whether it's because of this pandemic or not, right? I mean, sometimes the pandemic kind of triggers a lot of issues in people's minds and well-being. Hey, it's 9:10. Public health, the chief public health officer. We're going to go in with Chima Mbakwem. And then he's also bringing from the lab, Anne-Marie Santos, who's the Public Health Lab Administrator, Bureau of Communicable Disease Control, DPHSS. So we're going to find out more about this UK variant. We'll get an update on the status of the contact tracing and the cluster.